on holistic pain management in patients with chronic pain. These are the contributors for this presentation. The purpose of this evidence-based practice project was to investigate different holistic interventions that can be utilized to decrease levels of pain in patients with chronic pain and to see if these holistic interventions are more effective than using pharmacological pain regimens. The holistic interventions being studied for this project are acupuncture, meditation, massage therapy, exercise, and cognitive behavioral therapy. Though the purpose of this project was to find techniques that are more effective than pharmacological pain regimens, research has shown that these techniques are best used in conjunction with pain medication to decrease pain levels and decrease dependency on the pain medication. We're going to go into each intervention more specifically during the literature reviews. Our recommended intervention is to use clinical judgment to determine the appropriate holistic intervention or group of interventions that will work for each individual person, and to use that in conjunction with pain management in order to decrease pain levels and decrease dependency on pain medication. The outcome measurements used will be numeric pain scales to evaluate patients' pain levels, as well as documenting how often the patient requests pain medication to see if there is a reduction in frequency. Chronic pain affects up to 47% of the United States population, impacting a person's life far beyond just physical pain. The cost of treatment for chronic pain can be as much as $635 billion every single year. Pain is typically treated with medication, both opioid and non-opioid, leading to increased opioid dependency in the United States. Alternative therapies are needed in order to decrease the need for medications and prevent patients from developing dependency on opioids. Our clinical question for this project is, in patients with chronic pain, do holistic interventions reduce pain levels better than a strict pharmacological pain regimen? Our population is patients with chronic pain. Our interventions are holistic interventions for pain relief. As we discussed before, those are like the acupuncture, meditation, all of those. Our comparison is pharmacological pain regimens. Our outcome is reduced pain levels, and there is no time frame. So now we're going to start with our literature review, and first we're going to talk about acupuncture. In a study of 156 patients with chronic pain, 72% of those patients report using pharmacological interventions. After individualized plans of acupuncture during a 60-day period, the patients reported a decrease in analgesic medication and opioid medication use. On top of decreasing pain, the acupuncture also improved the biopsychosocial outcomes of these patients. In another study, auricular acupuncture has the ability to decrease severity of pain as well as severity of insomnia. When compared with the control group that received usual pharmacological over-the-counter medication for chronic pain, the auricular acupuncture group had a greater reduction in pain severity according to the Brief Pain Inventory pain severity and interference scores. In a third study, a group of 6 adults with chronic pain related to sickle cell disease received acupuncture twice a week for 5 weeks at a 30-minute time interval. All patients that completed this study reported not just decreased levels of pain overall, but also decreased levels of sleep disturbance, anxiety, depression, and anger. A fourth study showed that auricular acupuncture has been found to immediately decrease the numeric rating scale on an average of 1.3 points in 66.1% of veterans in a group of 24 that use opioids for pain, providing them with immediate relief from their pain. This study, though, did not find a significant decrease in pain long-term and no significant change in opioid use in this population. A fifth and final study of 38 patients with chronic low back pain had half undergo regular acupuncture therapy and half undergo regular acupuncture therapy in combination with thread embedding acupuncture. All 38 patients had a significant decrease in their visual analog scale for pain after 16 complete sessions. Our next intervention for pain management looks at meditation. Chronic pelvic pain is subjective physical and emotional experience that affects 24% of women worldwide. CPP has significant impacts on a patient's quality of life and is often resistant to surgical or medical treatments. Mindfulness meditation in chronic pain shows its most prominent effect on psychological aspects of living with chronic pain by improving associated depression and quality of life. The results showed a reduction in affective and sensory pain for patients using meditation. However, it did not show a direct reduction in pain intensity. The next study aimed to explore the experience of adolescents who participated in an 8-week mindfulness group adapted for chronic pain. Participants provided feedback by completing satisfaction questionnaires. Focus group data was transcribed and analyzed using inductive, simple, descriptive content analysis. Participants reported positive experiences including present moment awareness, pain acceptance, and emotion regulation. Participants suggested increasing the number of sessions and being clear at outset regarding a focus on reduction of emotional suffering rather than physical pain. Mindfulness is the non-judgmental observation of the ongoing stream of internal and external stimuli as they arise. Meditation was observed in a study of 60 patients suffering from chronic pain related to osteoarthritis. A visual analog scale was used to measure pain after 5 sessions. 28 patients reported significant pain reduction. This study further provides evidence that meditation may be a valuable strategy for chronic pain patients. The next study supports adjunctive use of mindfulness meditation interventions to control pain, substance abuse, and insomnia. Meditation is effective in management of chronic pain, improving functional status and psychological implications of pain. It also improves sleep and can be used for smoking cessation and to improve quality of life in individuals with substance abuse. Mindfulness meditation is best utilized as a self-management approach in addition to standard care. Virtual reality guided meditation has been used to assist mindfulness-based stress reduction. A total of 10 adult patients with chronic cancer pain underwent a virtual reality guided meditation experience while EEG signals were recorded during the session using a biosemi-active 2 system. The findings suggested that distinct altered brain signals are detectable during the virtual reality meditation. However, these changes were not necessarily associated with pain. These findings may further guide studies to investigate the affected brain areas with respect to the virtual reality meditation. Literature review, massage therapy. In this study, a 63-year-old man with chronic back pain had 4 massage treatments planned over a 20-day period. The Westbury Low Back Pain Scale 2 was used and self-reported. The results were found that from the first and last session, there was a 22% reduction of the Westbury Index. By the last session, the patient reported a pain level of a 0, and the subject felt that he could pursue daily activities that he was not able to before his treatment. The subject was able to reduce his pain medication and find an alternative in managing his pain to a better quality of life. Anterior cervical discectomy infusion, ACDF, is commonly associated with neck pain and can result to post-op issues. Massage therapy of the foot was used in 4 weeks to promote mobilization and the effects including reduction of neck pain, stress, and anxiety. 118 patients were involved in the study, 43 in the control group and 43 in their intervention group, were randomly assigned. Using the quality of life questionnaire, both groups showed a reduction in general pain, and post-intervention pain score of the intervention group was lower than the control. Overall, foot massages showed that it alleviated pain and was associated with decreased neck pain of patients that have undergone ACDF. In this randomized controlled clinical study, implementation of massage therapy in the post-op period of pediatric heart surgical patients were found to be well tolerated and safe. 16 children were participants of the study, and results found that the massage therapy group required less benzodiazepine medication. To relieve chronic pain, massage therapy has been studied as an alternative for pain relief. The study collected data on clinical process, demographic, and quality of life for patients receiving this method. A 396-bed rural medical center was referred or requested to a healing arts team that provided a massage or Reiki session. An 11-point Likert scale 0 to 10 was used along with patient report of scores in pain, nausea, fatigue, anxiety, depression, overall well-being. 1,585 patient counters were included, and improvement in symptoms were shown of 1 to 2 points of the 11-point scale, with a percentage improvement ranging from 42.9 to 59.9%. The overall findings determines that massage therapy does help with symptom relief, especially after the first session. The aim of the study is to examine the effectiveness of massage therapy for reducing pain and decreasing the use of opioids. About 30% of participants believe that they could never be pain-free and would need additional interventions to help with the coping. The group who felt they had potential to be pain-free will continue to adapt non-pharmacologic treatments for the future. Overall, the group that suffered with substance abuse did not believe improvement was observed in the 8 weekly Swedish massage sessions.
Next, we're going to look at exercise as an alternative therapy. A study done by Pullen et al. Evaluated pain and opioid use before and after physical therapy intervention in the HIV-positive population who experienced chronic pain. In this sample of 22 people, they found that after physical therapy treatment, about 77% had a decrease in pain, but only about 18.2% decreased in pain and opioid use. Pain ratings were self-reported using a numerical pain rating scale. For those individuals who had a decrease in pain and opioid use, it was found that home exercise programs, manual therapy, and self-pain management education were the common contributors leading to the decrease. This study showed that exercise may be an alternative therapy that can help with chronic pain in conjunction with pain medication, but it can also be a major factor in reducing the use of pain medications. In addition, aerobic exercise can be useful in reducing chronic pain without the use of pain medications. A study done by Bruhl et al. Looked at the effects aerobic exercise and endogenous opioid mechanisms had in individuals with chronic low back pain. The study included 82 participants with chronic low back pain and placed them into 2 groups, an aerobic exercise intervention group and a usual activity group. The The exercise group was put through an 18-session aerobic exercise intervention. What was found was that individuals in the aerobic exercise group reported significant reduction in chronic pain ratings when compared to the usual activity group. The intervention group also reported greater improvements globally when compared to the control group. A study done by Green et al. Found that individuals who utilized opioids when compared to a group not using opioids for chronic low back pain were able to engage in walking for further distances and meet step goals. The participants using opioids were more willing and able to engage in walking to help manage their back pain. Their findings support the use of alternative therapies like walking as a pain management strategy in conjunction with pain medication. Rasdalsmoen et al. Studied chronic pain in a large sample of university students and found that 54% of the students had chronic pain in at least one location. They found that there was an inverse dose-response association between physical exercise and chronic pain. Physical exercise increasing in intensity and more frequently were shown to lower the odds of chronic pain. Chronic pain locations were found to be fewer in those individuals who exercise more frequently. The study goes on to state that chronic pain is a major health concern worldwide and that physical exercise could be key to reducing chronic pain in young adults. Next, we're going to look at cognitive behavioral therapy as an alternative therapy for chronic pain. A study by Gilliam et al. Found that individuals who experience chronic pain often have some prevalence of PTSD symptoms associated with the chronic pain. Individuals who experienced this dual diagnosis were placed in a CBT-based program and were found to have higher impairment at pre-treatment when compared to other patients with just chronic pain receiving treatment. Post-CBT treatment, it was found that those with chronic pain and PTSD had significant reduction in pain severity, pain interference, and pain catastrophizing. They were also found to be virtually indistinguishable from the other chronic pain group after CBT treatment.
Evidence-based interventions. Clinical judgment. With clinical judgment, you can assess the patient accordingly and implement a holistic intervention for each individual patient. Comfort and distraction. With this, distractions may actually block pain signals from the body before they even reach the brain, so therefore, if your patient has tasks to get done, then they will give less attention to the area of pain. Deep breathing and relaxation techniques along with meditation. These techniques can help decrease pain, specifically with breathing. Deep breathing helps promote healthy blood flow, it releases toxins from the body, and aids in restorative sleep. Meditation has been found to decrease pain levels and decrease the reliance on pain medication as well. Acupuncture may actually relieve pain by releasing endorphins and being the body's natural pain-killing chemicals by affecting the part of the brain that governs serotonin, a brain chemical involved with mood. Massage therapy can be a very therapeutic way to help relieve pain in many ways, including relaxing painful muscles, tendons, joints, and even by stimulating competing nerve fibers and impending pain messages to and from the brain. Lastly, exercise is a common treatment for chronic pain, and it may help decrease inflammation, increase mobility, and decrease overall pain levels. Expected outcomes for holistic interventions in pain management are as follows. Patients' increased understanding of different non-pharmacological therapies to manage chronic pain. Patients will experience decreased pain levels as noted using a numerical pain scale. Improved quality of life of patients suffering from chronic pain. Nurses' increased awareness of holistic interventions to offer to the patients. Determine individualized care plans of the most beneficial holistic treatment for chronic pain specific to the patient.
So, some suggested evaluation criteria. How will the nurses assess or measure the effectiveness of our intervention? They can use a numerical pain rating scale to assess pain. They can utilize teach-back methods to assess the patient's understanding of alternative therapies. The patient will have a decrease in the frequency of using pain medications, and they will have an overall improved mobility, functionality, and quality of life.
Based on the research and literature literature that we've found, numerous holistic interventions have been found to be helpful in reducing pain levels in patients with various types of chronic pain when used in conjunction with pain medication, as well as decreasing dependency on pain medication. And below, you can see the number of articles for each level of evidence that we used for this presentation. Finally, we'd like to thank and acknowledge everyone that helped us put together and develop this project.